Hello, my name is Lucy Watts MBE and I'm a patient of the NHS. I'm also a member of the NHS England Personalised Care Strategic Co-Production Group. Just this week, an article by me appeared in the BBC talking about the COVID pandemic and the fact that my life might not be saved as I don't have as good a chance of surviving as someone else without health needs due to the fact that I have very complex medical needs and a life-limiting condition. I talked about my fears that I wouldn't be prioritised for ventilation and other intensive care measures, and that my life might not be seen as worth saving due to the rationing of healthcare services when the COVID pandemic reaches its peak. I was very pleased to see over the last few days NHS England release a letter from Ruth May and Professor Stephen Powis talking about the fact that personalised care is still a part of the NHS. They will endeavour to provide the best personalised care even through the pandemic and the peak. It's about taking things on a case-by-case basis, not making blanket decisions about people with a disability or older people or people with health needs. This is about personalised care, personalised to their unique needs, wishes and preferences, that takes into account all the factors in that person's life and, where possible, is a shared decision between the professional and the patient. This letter shows that the NHS wants to ensure that people receive high-quality care that meets their needs and does not blanket refuse people care or make decisions on behalf of a community. It's about taking that individual person's needs, wishes and preferences and working with those. It's also about the NHS Constitution and the principles of dignity and personalised care. I also want to say thank you to James Sanderson, the Director of the Personalised Care Group at NHS England, and others at NHS England who have worked really hard to make this letter happen, to make sure that personalised care is still a priority in the NHS, that they will endeavour to provide the best personalised care as far as is possible, and to make sure the lives of people like me are not blanketly refused treatment, that actually it's taken on our needs, our wishes as individuals, as unique people, and what's best for us in our care. So thank you to the NHS, to everyone who is working so hard to enforce good care despite the very difficult circumstances. And it also shows that NHS England have got the best interests of people like me, like you if you have a disability or health condition. They have them in the best interests at heart, and they want to make sure everyone gets the best high quality care with the best chance of surviving COVID if they suffer with it, or just surviving the pandemic due to their underlying health needs. It shows a great commitment from the NHS to make this happen. So thank you, NHS.